Hi everyone, I am Dr. Ramesh from Cessna Lifeline Veterinary Hospital. Today we have a 9 years of a dog who has got the ear hematoma, aural hematoma, and this is smaller, almost 40% ear is affected in this. And these ear hematomas, sometimes we try to manage them medically while removing the fluid and keeping a dressing pressure bandage over that area. But most of the time we end up getting other complication of eczema on the ear, and it will keep accumulating again. You need to keep the dressing for longer. So my first preference, in case clinically the dog is fine, we try to do the surgical way of handling these conditions, rather than we are just struggling with the medical management, which is more painful for the dogs and it takes long time, and the scarring is more with that. So how we do this kind of surgery in Cessna, I am just showing you. So what I am going to do is I am going to give a direct cut with the cautery rather than giving a blade cut to minimize the bleeding, and being I don't want this area to heal also faster. We are giving a cut now from here. So as soon as I given a little extra cut, it's been opened up. So we opened that area completely. It's a fresh case only. It's not a old case, this is fresh case. I'm opening it through completely, and then what I'm doing is, either you can curate the inside with a curator, or you can curate with the BP blade also. Sometimes you can't reach in inner area, so curate is better, but some areas we can curate with the blade also. Being it's a fresh case, directly we are going for surgery. We are not waiting for this, and the client is concerned. There are no fibrous tissues. Lots of time you get lots of fibrous tissue also in that. Now what I am doing is BP blade. So what I am doing is I am cutting some small portion of cartilage in between to increase the adhesions in this area while the healing process, because these are all smooth surfaces. Sometimes if you don't remove in between little, it will create problem, it will not heal, and sometimes there is some chance of recurrence. Maybe out of 20 cases, one of my cases is getting recurrence. In last 2 years, 2 cases has got recurrence. It's not full recurrence, but small area, some fluid may accumulate. So few areas we are just cutting this area, so that this area stick nicely to the down area, to the backside skin. Just debride this area, again little bit of debridement here also. If you try to do too much debridement, then it starts bleeding also. So I am just removing some part of the cartilage, not completely. So now we are going to start with the suturing. So we are going to start suturing from outer surface to inner surface, parallel sutures overlapping each other. So I'm just taking a bite from this, and I'm just going half of the other side skin, and I'm taking the bite. So you'll see this side there are no signs here. I have taken some tissue from other side. While putting the suture, my assistant doctor has to fold it, and then only I can just I have to oppose it one side, and it should not be tight, it should just oppose it nicely so that there should not be any gap, and try to keep this knot one side. While removing the suture, it's easier. The next suture I am putting from here till at the corner. So you can see whether you have taken the skin or not. You can just see with this. From here onwards, my artiforce is not going. If you put these stitches here first and then you can't check this area. So outer stitches you need to put first, and then you need to put the inners towards the medial side. So you can just feel it whether it's going to other side of the skin, and half of the skin get penetrated. So they should not bring the wrinkles in the ear, because if wrinkles comes, aesthetically the ear will not look normal later on. So it has to be stretched while putting the stitches. I can just keep rechecking in between whether some other area I need the suture. So I am overlapping this suture also. Every time if I have doubt, you can just check whether my suture is going through this, and I can check whether other side my suture is going. Can you see there's no sign of even the bites also not coming this side. So you can put the slip knot also here, and just put the slip knot. I am just pulling it and I am tightening it. I can tighten as much as required only. In these cases, if you tighten more, once the inflammation in the skin comes, it will tear the skin and it will go through and through sometime. So we need to just oppose it, not to put too much pressure. So the suture material which I am using, it's a 3-0 suture material, nylon with a cutting needle, so that it goes through the skin easily. In between this capillary bleedings are happening little bit, not a bigger concern. These are very simple surgery, but sometimes I have seen people struggling with these complications of these surgery, where they end up removing the ear only because of the complications. So despite of this is a very simple procedure I am putting on video, this video I am putting, so that the people understand the importance of suturing in this, how we suture this. Now we will check the other side, from which area we need to start. It is till the end here, it's ending here, so I need to just go till there and then keep suturing this area. So first suture I am taking from here. Try to learn this double slip knot. It's very useful even sometime when we want to suture in the cavities and all. It's very useful. So what I'm doing, I'm just putting a simple knot. I'm just going around and putting the second knot, and I'm pulling this. You see, it becomes a knot. And it doesn't get loosened while by the time when you are putting the other knot. So it's very handy if you know this kind of suturing technique. It's very handy. So again I'm showing, I'm just putting one loop, another loop. Once it's in this position, you just pull this. The longer thread you need to pull, and it just get logged nicely. You can keep checking whether I need 3 here or 2. I think I need 3 because it's still here. So you can see the assistant has to hold this as a flat, so that we get good opposition and we good flat surface while when we finish the suturing. You must have seen some videos where it just crumbles together the skin. Here probably 2 is enough. I'm just feeling with this finger where my needle is going, and I'm Sometimes I just put this area, one suture closer to this to bring the opposition a little better, and this also I need to take the bite from inner side. It's not mandatory to take, but I try to make sure that these ends healed also properly and within 10 days, so that we can remove the flap. So we are going to discuss about the flap technique now, putting a sponge flap. Okay, can I get little saline to clean it? So now we can see that this surface is very clean surface. There no even small bite also hasn't come this side. It's completely flat. This we have done now. We are able to see all this part. One of my suture looks a little loose. I'm going to apply one suture here. One suture I'm going to remove. The suture is a little loose. I'm just putting another suture probably here, and then we'll start the next step. So this is what we have done. We are going to wash it little. Tissue after that. So we'll just clean it with the saline nicely. Okay. I'm going to dry it nicely. So now we are going to apply this sponge over this area, so that we don't need a dressing. We can just keep a e-collar alone and we manage it. So this we are going to keep for 10 to 12 days, and sutures, these sutures then we'll remove this flap, and these sutures we are going to keep for 16 days at least, and then we remove this once the healing takes place completely. So we need to put in this direction. This cloth will come to outside and this sponge will come inside to give a spongy effect on this. And this size, it comes in bigger size, so we have done autoclave again for this ETO, and we are using this small piece because it's a smaller one area is affected. For this I use 2-0 suture material, and we go through and through by it. So what we do, we just go through and through by it. Keep holding this tightly so that capillary bleeding should not. And these bites, better to take vertical bites rather than taking horizontal, because in horizontal bite sometimes any blood vessel may come, because this is a through and through bite. So this is a first, probably we can put 4 to 5 sutures. Then I am putting this here and I am bringing it back. You don't have to put too tight also, it should just oppose only, just to keep any bleeders and all in control when they flaps their ears too much. So there won't be any dressing, there won't be any other post-operative care in this. There will be just cleaning the ears, and if they have some, most of these condition happens because of the ear infection, so you need to definitely treat the ear, whatever condition in the ear going on, whatever infection is there, that don't ignore, because then if his ear infection, ear problem is still persisting, ear canal problem still persisting, the chance of recurrence is more, because they'll keep flapping their ears again and again and causes the problem. So then we just cut this extra portion, and that's all. So we are going to keep him in e-collar for at least for minimum 12 days, and after that 10 to 12 days later we remove this, and then sutures on 16th day. And we do good pain management medications, and that's all about this surgery. Thank you.